Pelvic pain in females can stem from various gynecological, digestive, urinary, or musculoskeletal issues, as well as psychological factors. Common causes include menstrual cramps, endometriosis, ovarian cysts, and pelvic inflammatory disease, PID. Other potential causes include digestive tract disorders like constipation or irritable bowel syndrome, urinary tract infections, and musculoskeletal problems. Detailed causes of pelvic pain in females: gynecological, menstrual cramps, painful contractions of the uterus during menstruation are a common cause of pelvic pain. Endometriosis, a condition where tissue similar to the uterine lining grows outside the uterus, often causing chronic pelvic pain. Ovarian cysts, fluid-filled sacs on the ovaries can cause pain, especially if they rupture or twist. Pelvic inflammatory disease, P, an infection of the female reproductive organs, often caused by sexually transmitted infections like chlamydia or gonorrhea. Fibroids, benign growths in the uterus can cause pelvic pain and pressure. Ectopic pregnancy, a fertilized egg implants outside the uterus, often in a fallopian tube, leading to severe pelvic pain. Miscarriage, the termination of a pregnancy before 20 weeks can cause pelvic pain. Other, Cleveland Clinic says that other gynecological causes include ovarian and uterine cancer, cervical cancer, and adenomyosis. Digestive, constipation, difficulty passing stool can cause pelvic pain and discomfort. Irritable bowel syndrome, IBS, a chronic digestive disorder that can cause pelvic pain, bloating, and diarrhea. Diverticulitis, inflammation or infection of small pouches in the lining of the colon. Ulcerative colitis, a chronic inflammatory bowel disease that can cause pelvic pain. Urinary tract infections. UTIs, infections in the urinary tract, can cause pelvic pain, burning urination, and other symptoms. Interstitial cystitis, a chronic condition causing inflammation of the bladder wall, leading to pelvic pain. Kidney stones, hard deposits in the kidneys can cause severe pain that may be felt in the pelvis. Musculoskeletal, pelvic floor muscle spasm, tightness or spasms in the muscles supporting the pelvic organs can cause pain. Musculoskeletal disorders, conditions affecting the bones, joints, or muscles in the pelvis can cause pain that may be felt in the pelvic area. Hernias, protrusions of tissues through weak areas in the abdominal wall can cause pain in the lower abdomen and pelvis. Psychological, sexual trauma, past sexual trauma can sometimes contribute to chronic pelvic pain. Psychological factors, anxiety and depression can exacerbate pelvic pain and make it harder to manage. Other, sexual activity, pain during sexual activity can be a cause of pelvic pain, especially if it's related to underlying conditions like endometriosis or vaginismus. Vaginismus, involuntary muscle spasms in the vaginal area, which can cause pain during sexual activity. Vulvodynia, chronic pain in the vulva that may be triggered by touch or other stimuli. Mittelschmerz, painful twinge between periods, usually on the day of ovulation. Premenstrual syndrome, PMS, symptoms experienced before menstruation including pelvic pain and cramping.